A leading sexual health clinic made a big mistake on Tuesday. They sent an email to 780 patients that had the names and email addresses of the other 780 patients. Now, this was, just as I said, a mistake. They didn't do it on purpose. There was no hack, no ill intent, no malice, but patients are understandably upset that they have been outed as being a patient at this clinic. Now, many of these patients are HIV positive or being treated for HIV or AIDS, which is a concern to those patients because they're afraid that they didn't get the chance to tell people. However, and this is a big however, the email only went out to other patients. For someone to release that information would also be releasing their own information. So, as bad as it is, chances are that the information is pretty safe with the people who have it. Also, the company immediately realized that there was an error and began contacting patients. So it's not as though they tried to hide it or they didn't take responsibility. That being said, they are calling it something that is completely unacceptable. And they say that they're investigating how it happened and that they're taking steps to ensure that it doesn't happen again. Now, I honestly and truly hope that in those steps, they do not fire the party who sent the email. And here's why. It was an accident. There is a CC line and there is a BCC line. Now, what they're supposed to do is take their email list and paste it into the BCC line, blind carbon copy, which would mean that no one would be able to see the emails. However, what happened yesterday was that the emails were accidentally pasted into the CC line. I think many of us have done something like this before. Either sent an email to someone we didn't intend to, or forgotten to blind carbon copy someone when we wanted to include someone kind of secretively into our conversation. The problem is, what we do on a daily basis isn't this large scale. What happens in a leading sexual health clinic is so large scale that it becomes a news piece, it becomes a trending topic, and it becomes something that people are talking about. I feel for all of the patients who are experiencing turmoil because of this, but I hope that they can reason to themselves that their information is still relatively safe, that it's not out to the general public, and I hope beyond hope that the person who did send the email is given another chance, because, as I said, it was an accident that could have happened to anyone, and it just so happened to happen on a large scale. And I may get a lot of flack for this because I feel that the person deserves a second chance, but those are my feelings and I can't change them. So that's it for tonight. Thank you for tuning in to an Ask Bee's Point of View, and we'll see y'all tomorrow. Bye.